Welcome to the dental tutorial titled An Alternative Dental Treatment to Porcelain Crowns, Porcelain Veneers, and Metal Braces, a non-invasive approach utilizing sophisticated Invisalign orthodontic and teeth whitening concepts. To keep things as copacetic as possible, please read the appropriate disclaimer. I would like you to appreciate how I, along with the patient, arrive at the most appropriate treatment. Let's follow the experience of this young man who has an obvious main concern. His smile-specific concerns are his two front teeth are darker and more yellow. Previous dental teeth whitening attempts did not satisfy him or his dentist. Bonded fillings previously placed on those two dark teeth had chipped off. He was entering his last year of college. He did not want to worry whether his smile might be a factor, however subtle, why he did not get a job. And as many of us are, he was also aware that an improved smile might help him in social and professional situations. We need to consider the smile and the long-term health implications. While playing baseball when he was 7, he was hit flush in the face with a batted ball. Those teeth have been dark yellow for the past 15 years. He's had root canal therapy, composite bonded fillings, internal whitening, as well as removable sequential clear orthodontic therapy with Invisalign. This is his digital panoramic X-ray. You can see these two white lines. That shows where the root canal was performed in those two dark yellow teeth. Why did he seek a second opinion? He was not sure that he wanted to have his teeth shaved down for porcelain veneers and crowns. Also, the cost estimate for the treatment was significant. His dentist had recommended a combination of porcelain veneers and crowns. These two teeth were previously bonded, but the fillings kept on chipping off. He had orthodontic therapy in high school, but he was not as compliant as he could have been. He had these two teeth bleached or whitened. However, they never got as lighter as he would have liked, and it only lasted weeks, maybe a couple of months. Once a dentist has seen bonding, teeth whitening, and Invisalign orthodontic therapy be unsuccessful, it is not uncommon for them not to recommend those same treatments again. They might simply feel more comfortable starting fresh. So he searched the internet to find a treatment solution that would give him what he wanted, a natural-looking, healthy, and long-lasting smile that would fit within his and his parents' budget. While I proposed similar sounding dental treatment to those previously provided, there were distinct differences that I was confident would yield better and longer-lasting results. It could not be determined whether the goal of his orthodontic therapy in high school was mainly for aesthetics. From his description, it appeared that the focus of his prior Invisalign ortho treatment was simply to eliminate the crowding, straighten his front teeth, and close the gaps between the top and bottom front left teeth. These are the bird's eye view of the bottom teeth and the top teeth. Notice the crowding that might not have been quite as visible with the straight-on view. One of the things that distinguishes my technique is that I move most of the teeth in the mouth. I idealize the arch form. Once I make sure that's as ideal as possible, I make sure the back teeth, top and bottom, mesh as well as possible. Last, but not least, I address the function and appearance of the front teeth. The two dark teeth are an ideal indication for the Manhattan method for teeth whitening, a technique I developed in 2010. The primary purpose is to conservatively correct uneven smiles where one or two teeth stick out because they are darker than the others. This will be done concurrently with his Invisalign therapy. These photos are from a different patient who had the Manhattan method of teeth whitening. Notice the front dark tooth, which now blends in beautifully. So nicely, in fact, if you didn't see the before photo, you might not even suspect that this tooth at one point was darker than the teeth next to it and underneath it. Because his prior bonding kept chipping off and dislodging, the fillings would be placed near the end of therapy, once his bite had sufficiently improved. A bad bite, the formal term is malocclusion, can lead to undesired chips and cracks in fillings, teeth, and crowns. Before treatment started, I did a virtual simulation. By planning in advance, the likelihood of a problem occurring once treatment started was minimized. When someone lives 3 hours from the office, I tried to minimize the likelihood of an emergency visit. As a D1 student athlete, he had very little free time. With proper planning, seeing patients every 3 to 6 months works out just fine. As is evident, there was a dramatic difference over the 9 months of therapy. This is how he looked after 1 month. Notice there's a slight band of dark tooth still remaining, but the majority of the teeth are now blending in much better with the adjacent teeth. He confirmed that by the end of the first week, these 2 teeth had become lighter than at any time during any of his prior whitening attempts over the past 15 years. After 4 months, the rings around the necks of the teeth have become much less noticeable. Also, the chips at the incisal edges are less noticeable. That's because the teeth are being rotated back into their proper position. This was shortly after the 2 composite bonded fillings were placed. Clearly, he achieved a wonderful result. His teeth match and blend in beautifully. He now has a natural and highly lustrous smile. The bite is still being tweaked. It's about 90% complete. From a health and longevity standpoint, he is thrilled that not one tooth had to be shaved down. This treatment was a fraction of the cost of the proposed porcelain veneers and crowns treatment recommended by his hometown dentist. His mouth feels the best it has ever felt. Everything fits just right. From a personal and professional standpoint, it was a pleasure to provide such a terrific young man with the dental care that should serve him well for decades. I am Dr. Elliot Davis, the Manhattan Dentist. Thank you for your interest and for watching.